Listeria, the listeria vaccine is one approach to stimulating the immune system. It's potent, very potent. It's able to stimulate sort of both arms of the immune system, innate and adaptive, which is beneficial. It's able to stimulate helper cells, which, as their name suggests, helps the immune system, as well as killer cells, which are important to kill the tumor. And of course, most importantly, the side effects from it are pretty transient. And so that's very important too, particularly, as a veterinarian, one of the things that we're most focused on is quality of life in these patients. As its name suggests, it is actually a bacterial vaccine, and the bacteria is listeria. And many people may have heard of listeria because in its wild type form, it's actually a bacteria that causes food poisoning. Because it is a very potent inducer of the immune response, you could actually take that listeria and sort of modify it, add a targeted sort of an antigen in there, a tumor molecule, and incorporate that into the listeria. And then when you deliver the listeria into an individual, that individual makes an immune response against listeria. And of course, also then it makes a very strong immune response against the tumor molecule that you've put into that listeria. The idea is the listeria actually goes into, it seeks out immune cells in our body that are known as antigen presenting cells. And when we sort of break that down, what those cells do is they present antigens to the immune system. And that has to happen for the immune system to recognize those and to act against them. So listeria in its own biology naturally goes to these antigen presenting cells. So you can think essentially of it as a sort of a Trojan horse. It's going to carry these tumor molecules into those antigen presenting cells. And then it's going to induce a very potent immune response. We don't want to make patients sick. So the listeria itself is highly attenuated. So it's really unable to move from cell to cell. It's unable to do that. It is live. It's a live vaccine, and it has to be alive for it to exert its effect. But it is very highly attenuated and easily eliminated by the patient's immune system. So the idea is that the patient doesn't develop a listeria infection, for example, and does not become very sick from the listeria itself. The side effects that we do see are low grade and transient, which of course is important, and they are related to the immune stimulus that the vaccine causes. And so within about 2 hours of administration of that vaccine, you start to see the patient's temperature increasing. And that's because of the immune response. And they also can have some low-level nausea, perhaps a couple of episodes of vomiting that usually occur between 2 and 4 hours following a vaccine administration. But it's transient. So you'll see this sort of increase in fever. They don't feel very well. They may have a couple of episodes of vomiting, and then their temperature comes back down again. And I always like to say we give them sort of the cookie test. So at the end of the day, they get offered a biscuit or a cookie. And if they eat that, then they're ready to go home. We have done a study combining it with radiation therapy. Radiation has this effect that we call immunogenic, meaning it stimulates the immune system, immunogenic cell death. And so, the idea is to sort of kill off some of the tumor and then stimulate your immune response, which will come and sort of pick up those dead tumor cells, present them to the immune system to give you a better boost of anti-tumor immunity. Certainly at the moment, we've looked at dogs with osteosarcoma, and the reason for that is we were able to demonstrate that there's a molecule associated with osteosarcoma. It's a target antigen called HER2 and it's actually commonly expressed in what we call HER2 positive breast cancer. And so this vaccine was initially developed with the HER2 target antigen in it as a potential treatment for women with breast cancer, with HER2 positive breast cancer. But what we really wanted was to determine whether that vaccine was capable of preventing metastatic disease. In order to do that, you need to have a system where you know that that patient will go on and develop metastatic disease. You have to have that as a sort of a baseline so that you can see if your treatment to prevent metastatic disease works. And so oftentimes with mammary carcinomas, or sometimes with mammary carcinomas in dogs, if you are able to cut it all out, it's not going to come back. Now, that's not in all the cases, obviously, but with osteosarcoma, one, we were able to demonstrate that HER2 is expressed in canine osteosarcoma. And two, just associated with standard of care, which in dogs that naturally develop osteosarcoma is amputation and follow-up chemotherapy. The vast majority of those dogs will go on to develop metastatic disease. So if we then vaccinate those patients, and we see that less of them are developing metastatic disease, or it's taking them longer to develop metastatic disease, then we know we're having some effect. This is all sort of theoretical at the moment, but I think it's important to think about it. An immunotherapy, when you give that to the patient, it actually acts on the patient's immune system, and then the patient's immune system kills the cancer. If you have an immune system that isn't working very well, and if that immunotherapy is unable to appropriately activate the immune system because it's just the immune system's damaged in some way, then it follows that that patient may not respond very well to the immunotherapy. Whereas if an individual has a very strong, robust, or fit immune system, then the thought process might be that an immunotherapy might be more effective in that individual because that individual has the appropriate tools that are functioning properly to become activated and to kill the tumor. It can be very specific. So the idea is it would specifically eliminate the target cells, as opposed to some of the chemotherapies that will target your bone marrow, and that's why you become immunosuppressed, or target your gut, which is why you can have anorexia or vomiting and diarrhea and so forth. So the idea of immunotherapies in general is that we're sort of taking advantage of the property of the immune system, which is antigen specificity. It's going to very specifically target the tumor antigen that you're going after. So that's very important. The other important property, several other important properties is of the immune system is what we call immune surveillance. So your immune system is everywhere. It's all throughout your body. It's active all the time, looking around. Are you being invaded by a pathogen that the immune system needs to go and get? So that's very helpful because we need that immune surveillance because we don't know where the metastatic tumor cell might be. There may be sort of one of them that's peeled off somewhere. And we can't cut that out with surgery. We can't direct radiation therapy against it. But the immune system has the potential of finding it and eliminating it. So this immune surveillance is very important. And then I think the third property of the immune system, which is very important, is immunological memory. So, once you get sort of your immune system stimulated against an antigen, and we see this, of course, when we all get vaccinated, then your immune system remembers it. So the next time you're infected, for example, with that particular pathogen, or the next time that tumor pops up again, the idea is that the immune system will be there, active, ready to go and eliminate it. And the listeria vaccine is one approach to stimulating the immune system. It's potent, very potent. It's able to stimulate sort of both arms of the immune system, innate and adaptive, which is beneficial. It's able to stimulate helper cells, which, as their name suggests, helps the immune system, as well as killer cells, which are important to kill the tumor. And of course, most importantly, the side effects from it are pretty transient. And so that's very important too, particularly, as a veterinarian. One of the things that we're most focused on is quality of life in these patients. And I think that's one of the nice things about the listeria, is that we found that it really is very well tolerated. I do think it's really an exciting time, particularly with immunotherapies. And I do think we're going to start to see outcome of some of these canine patients change, which, as I said, sort of 10 years ago, 5 years ago, people, I don't think, would ever think that their dog could potentially be effectively treated and possibly cured. We're not there yet. Don't want to know big sort of fanfares yet. We're not there yet. But I think the tools are starting to get into place where we're starting to make sort of inroads in certain tumors.